Peru News Today. All you need to know about Peru.
Peru registers its first 3 deaths from COVID-19 in 2024. Confirmed cases in Áncash and Trujillo. Diresa Áncash confirmed a death after increases in coronavirus cases in Peru. 2 other fatalities in Trujillo had comorbidities, health authorities indicated. This Wednesday, January 3rd, it was confirmed that 3 people died in Peru due to COVID-19 in 2024. The cases were corroborated by specialists from the Ministry of Health. The first corresponds to a 43-year-old man, who was admitted to the intensive care unit of the Victor Ramos Guardia Hospital, in Huaraz, Áncash region. Meanwhile, the other 2 victims are women aged 68 and 85, respectively, in the city of Trujillo, La Libertad. Both had comorbidities, according to Trujillo health authorities. How was the first case of death from COVID-19 recorded in Peru? The first death of 2024 from COVID-19 was recorded in the city of Huaraz, Áncash, and corresponds to a 43-year-old man. The patient was admitted to the intensive care unit, but did not recover. However, it is unknown if he had any comorbidities or risk factors. The regional government of Áncash, through the Regional Health Directorate of Áncash, regrets to report the sensitive death of a person due to coronavirus infection in our region. This Monday, January 1, 2024, the entity announced in an official statement. It is important to highlight that, in recent weeks, an increase in suspected coronavirus cases and respiratory diseases was reported in said hospital in Huaraz. Given this, it was determined that patients, nurses and doctors at this hospital center will once again mandatory use masks. What is the background of the second death from COVID-19? The second case of COVID-19 death corresponds to an 85-year-old woman, who had the following comorbidities: high blood pressure, pulmonary fibrosis. Although the case at one point was handled as suspected coronavirus, the regional health manager of La Libertad, Aníbal Murillo, confirmed hours later that the woman did carry the virus. On December 29, she was admitted to the regional hospital due to acute respiratory failure. We spent several days trying to help her, but unfortunately she died, she told Canal N. It was also reported that the patient did not have the bivalent booster vaccine. The latter helps protect against the original virus and the Omicron and E.G.5 Iris variant lineages. Third death from COVID-19 confirmed, new cases registered in Trujillo. The Republic contacted the epidemiologist at the Belenda Trujillo Hospital, Pedro Diaz Camacho, who confirmed a second death from COVID-19. This is a 68-year-old woman from the district of Victor Larco, who entered the hospital on December 30. According to Diaz Camacho, the patient had comorbidities and was admitted to the hospital in a serious state of health. She had comorbidities such as high blood pressure and a complication of disseminated intravascular coagulation. She only had 3 doses of the vaccine, said the doctor. At another time, she called on citizens to get vaccinated and complete the 5 doses of it. I call on the Trujillo population, over 65 years of age, to go to the nearest health center and complete their immunization schedule, asked Diaz Camacho. Leave us your comment and subscribe to continue growing, and follow us on our social networks, Facebook, YouTube, Instagram and TikTok.
Peru News Today. Follow us on Facebook and Instagram.